An example of some of the implants that we use for knee replacement are made of metal and plastic, very much akin to what we use in hip replacement, shoulder replacement, ankle replacement. We use hardened metals. Most of it's titanium. They have small amounts of nickel in some of them, but in the type that most of us use here at this practice is less than 1%. Some people have a nickel sensitivity, and we ask the patient to let us know that because there are implants that are completely nickel-free. But you have about 3 flavors of implants that you can use. You have what's shown here is a total knee replacement, where we put an end coat on the end of the femur being depicted in clear plastic here, much akin to a dental crown. We're not replacing the end of the femur, we're just putting a cap on there. And when you look at the shape, it's very much like the natural anatomy of the knee, and that's what we want. On the tibia side, we do a flat skim cut to remove the arthritis. We put another titanium-based implant on there, usually without bone cement at each, and then we snap in a piece of plastic to now act as the new bearing surface to take the place of both cartilage and the menisci, the medial meniscus and the lateral meniscus. Okay, and the two of them are able to be removed, and also can help with the cruciate ligaments because of the shape of that plastic. If you look at the end of the femur, basically what we're doing during the case is creating this geometrically shaped, reproducibly shaped structure that we can put a sized implant in place during the case, and it has such a surface that the bone grows onto it. When it comes to partial knees, it's a smaller knee, as the name would suggest. Some people have arthritis in part of their knee. By convention, we divide the knee into the front of the knee behind the kneecap, the inner side of the knee, and the outer side of the knee. And we call it 3 compartments, although it's basically 3 wings of the same house. If you have arthritis in one of those wings of that house, well, why do we have to redo the house when we can just redo the wing? In my practice, I do a fair amount of partial knee replacements. You can replace the front portion of the knee, which is putting a plate about the size that I'm showing here, not really as large as a total replacement to a femur. And this is something that is just serving as a plate to replace the arthritic face of the knee. The kneecap, which is not depicted on this model, also gets a plastic button put on it. And that's an example of a patellofemoral joint replacement, or a kneecap joint replacement. Usually it's a faster recovery than a total knee replacement, and it is one that over the course of a calendar year, you're probably about 2 or 3 months ahead of where you'd be as a total knee replacement. The more frequent partial knee is when we replace just the side of the knee, usually the inner side, the side on right here, the side closest to the other knee, and that inner side of the knee will be replaced with, again, smaller implants, where we just replace part of the femur and we replace part of the tibia, and we use a smaller bearing surface. So everything's smaller, smaller, smaller. And it's actually a harder case than a total knee, because a total knee, it's everything we could set to whatever angle we want, but in a partial knee, we're limited by the native anatomy and the rest of the knee that we're not touching. But in the same sense as a patellofemoral replacement, a unicondylar knee, some people call them unis, that has a faster recovery period and a faster cycle. But it's a very particular patient that requires it and is eligible for it, but they tend to do very, very well. The longevity of the partial knees is not as good as the longevity of a total knee. These implants in a total knee, most of us will counsel our patients that they should last about 20 years or more in about 85 to 90% of patients. The partial knees with the patellofemoral replacement, if I can get 10 to 12 years of that implant lasting, that's a success, and it's often a very easy conversion. And then for the uni knees, if we can get anywhere from 10 to 15 years, again, I view that as a success, because what happens in the partial knees is not that the implants fail, it's that the rest of the knee can suffer arthritis and need to be replaced. So that's usually why we're bringing you back to the operating room.